Hello everyone, welcome back to my channel. So this is a continuation of dissection series. So those who haven't seen the previous sessions, please do watch it so that you will get a continuity. So in this session, I'm going to talk about the muscular spaces around the scapula. There are mainly three spaces. They are the quadrangular space, upper triangular and lower triangular space. Out of these three spaces, quadrangular and lower triangular spaces are seen in relation with the humerus, and upper triangular space is seen in relation with the scapula. And we have major structures within these spaces, so that if you do any surgery, we can approach these structures and we can ligate or we can suspect injury to these structures depending upon its relation with the muscles and the bones. So that is the importance of knowing the boundaries and contents of the muscular spaces around the scapula. Now, in order to understand these, you should know mainly two things. One is there are mainly two muscles forming the common boundary for the quadrangular, upper triangular and lower triangular. The two main muscles are, one is long head of triceps and the other one is teres major. So teres major and long head of triceps both are forming common boundary for the quadrangular, upper triangular and lower triangular spaces. The next one which you should know is how to align these muscles when you form the spaces. So I would like to show one easiest way by which you can remember the boundaries and contents of the quadrangular and triangular spaces. So please keep watching. I'll be doing it in the next session. Thank you.